welcome to the Natural PCOS podcast, the podcast dedicated to empowering women with Polycystic Ovarian Syndrome through natural approaches. I'm your host, Dr. Samina Mitha, a naturopathic doctor with a passion for women's health and hormones. Each episode, I'll explore the latest insights and my personal experience to help you manage your PCOS naturally. Together, we'll dive into practical tips, inspiring stories, and the latest research to support your journey towards balance and wellness. Let's get started on your path to thriving with PCOS naturally. Hi, everyone, and welcome to the very first episode of the Natural PCOS podcast. I'm so excited to be here talking all about PCOS, and I really hope you can get some valuable information out of this very first episode on what is PCOS and how can I really understand everything about it. Well, first things first, what is it? When we talk about PCOS, what is the acronym actually stands for? It's Polycystic Ovarian Syndrome. And I actually had a conversation the other day where we were talking about how, the person didn't have cysts on their ovaries, but they're displaying all the other signs of PCOS. So the name isn't actually the best. The reason why is because you don't have to have cysts on the ovaries to actually have PCOS. Now, when I think about what is PCOS, underlying what is this syndrome, I think about it as an endocrine and hormonal condition. And when I say endocrine, it really can impact that metabolic system. And endocrine also goes even further to go into our hormones as well. So that interplay between estrogen and testosterone and insulin and testosterone and also progesterone. But what we're really looking at is this syndrome that affects so many different parts of the body and a myriad of symptoms that kind of comes together to be called PCOS. So really an endocrine disorder that's impacting not only our metabolism, but also our reproductive system as well. And when we think about what are these symptoms that we're actually experiencing, I would say obviously the number one symptom, if you don't already, is weight gain. But a bigger part of that is all these testosterone-like symptoms: excessive hair growth, acne, hair loss, fatigue, bloating, even mental health issues like anxiety and depression, irregular cycles, like something that a lot of women with PCOS experience. That is one of the biggest reasons why a lot of them reach out for help at the very beginning. And really, with the diagnosis of PCOS, how we're actually diagnosing it is through lab work and ultrasound. Now, oftentimes somebody will, be struggling with their weight, or they will also have irregular cycles, and that's what will prompt them to actually go and get some testing done. And in the testing, that's when we start to see, high levels of testosterone, polycystic ovaries, insulin resistance present, and that's where the diagnosis is coming into play. Now, it's really important if you're thinking, I don't know if I have PCOS, but maybe I could, to always be getting an ultrasound and blood work done for that confirmation of PCOS. When we're thinking about, what would prompt me to actually go and get something like this checked out is if you're having irregular cycles more than 35 days, if you've missed a period for a few months, if you're spotting on end, those are a few signs to get yourself checked out. Also, if you've gained weight really quickly in a short period of time, or even just in general have issues with weight and have had that for a while, that's another sign. Another thing is if you've really struggled with cystic acne, even in your teen years, and now it's kind of creeping back up again later on in life. That's another reason why you should really go and get your blood work done, especially because acne can really influence and be really a part of this syndrome. Other signs to look out for are things like family history of diabetes, feeling hangry all the time, and maybe you're experiencing boils. This is something that a lot of people don't necessarily realize, but it's really related to insulin resistance. Belly weight, fatigue, but also then feeling wired at nighttime. This is a sign that something could be going on there. But truly, the signs we should be looking out for are these high testosterone-like symptoms: acne, excessive hair growth, and hirsutism. Hirsutism, which is excessive hair growth, but then also hair loss, this male pattern hair loss, which is really important to get assessed for, because hair loss can be also and other causes of hair loss can be present too, like nutritional deficiencies, iron especially there, maybe the thyroid too. So it's really important to really get that assessed. Now, what if you go and you're like, I think I have PCOS, I get everything tested, everything comes back that everything looks completely normal and you're perfectly fine and you don't have PCOS and you shouldn't worry about anything. And if you really want to regulate your cycles, you can go on the birth control pill. This is a really common conversation that happens with patients and their family doctors or just healthcare professionals, just based on what I've been told. And you still feel like, no, there's something wrong. I've literally tried everything and I'm still not being able to lose weight and my cycles are irregular. Oftentimes, the lab work isn't properly assessed, or not all the labs are maybe there to actually really give us that diagnosis. So, for example, when we're testing testosterone, we really want to test for a few different types of testosterone: androstenedione, DHEAS, free testosterone, total testosterone, and even maybe go as far as testing dihydrotestosterone, which is DHT. This is our most potent form of testosterone. This is what can cause some of these issues like the hirsutism, the hair loss, the acne. So say, for example, you get your testosterone tested. So you're like, hey, Samina, I actually got every single thing you said and it looked normal. Everything was within range. Oftentimes, even if testosterone looks like it's within range and you're still exhibiting these signs and symptoms of high testosterone, this is another reason to say that you probably still have high testosterone. And the reason why is when we look at Rotterdam criteria, so the diagnosis of PCOS. Diagnosis of PCOS says, first, they should have clinical signs and symptoms of high testosterone and or high testosterone in the blood. So even if your blood work comes back normal, but you still have clinical signs and symptoms of high testosterone, this is a reason to say that you probably still have high testosterone present in the body. It's just not being caught on that blood work. Then the other thing we want to look at on Rotterdam criteria is an ultrasound. Is there polycystic ovaries? Now, oftentimes people will get confused because their ultrasound will say multiple follicles on the ovaries, which that doesn't sound like anything like a cyst. And this is correct. You can actually have multiple follicles on the ovaries, and follicles are basically what house an egg. Many, many, many follicles kind of sitting in that periphery of that ovary, so just on that outside lining of it, can actually be a sign of PCOS as well. So you don't actually have to have like a actual cyst to say that you have PCOS. Even if you have multiple follicles present there, that's a sign again that PCOS is present. Typically, we don't want to see over 10, maybe 12 follicles present there on each side. So if we're creeping up to that, 20 plus, then that's a really good sign that polycystic ovaries are present. You can actually have polycystic ovaries and not the syndrome. What really puts you into that syndrome piece is if you have symptoms of high testosterone, because also now the Androgen Society is saying that you have to have clinical signs and symptoms of high testosterone or high testosterone in the bloodstream to actually be diagnosed with PCOS, which is really interesting. Then last but not least on Rotterdam criteria is the cycles that are irregular. So say, for example, like you've been through puberty, you're in your 20s, maybe now you're in your 30s, and all of a sudden, when you turn 25 or whatever it is, or maybe you turn 32, all of a sudden your cycles become irregular. And you're like, hey, I actually had regular cycles, and all of a sudden now my cycles are irregular. And now they're telling me that I probably have PCOS. But why did this happen? Like, why are my cycles so irregular? Oftentimes, actually, from what I've seen through practice and my own personal experience of being diagnosed with PCOS, when something big changes, maybe you go to university or you move countries or something happens, it can really trigger these genes to turn on and to really set us into that stage of PCOS where the testosterone will come up, insulin resistance gets worse, from what I've seen clinically. So it says you have to have 2 out of the 3 that I just talked about: irregular cycles or no cycles, clinical signs and symptoms of high testosterone or high testosterone in the blood. The clinical signs and symptoms of high testosterone, the irregular cycles, and then cysts or follicles on the ovaries, which is really important when we're diagnosing PCOS, to look at not only the blood work, but then also to look at the ultrasound. And when we say, okay, everything looks normal on blood work, I don't have insulin resistance, but you still are having trouble really losing that weight, oftentimes something that I like to run is called an insulin glucose challenge test. This is a test that is similar to the oral glucose tolerance test. So you take in 75 grams of glucose. First, actually, they test your fasting glucose and your fasting insulin. You take in the 75 grams of glucose. So it's a really horrible drink. If you've had this test done before, you know exactly what I'm talking about. It used to be orange here in Canada, and now they've changed it to clear solution. And I think that makes it even worse. But anyways, you drink the drink, and then they test you after half an hour that you've taken the drink, an hour after you've taken the drink, and then 2 hours after you're taking the drink. What we're trying to see is how well can you actually process all of that glucose that's coming in. If your insulin is high and it comes up pretty high in fasted state, and then also on the half an hour, hour, and 2 hour, and your body can't bring the insulin down, then there's definitely insulin resistance present. The other thing is, we know women with PCOS actually just make more insulin in response to glucose. And some make more insulin than others, but oftentimes too, at that 2 hour mark, our insulin should be coming down. And what is happening in some individuals is that insulin just keeps going up. Pancreas keeps secreting the insulin, even though there really isn't any glucose present. Now, in a case of that, it can make those testosterone symptoms worse, because higher levels of insulin can increase testosterone, and vice versa, actually. So it's really important to dive deep into the lab work. If your HbA1c looks okay, this is a marker for actually assessing and diagnosing diabetes. If it looks perfectly normal, you're sitting at 5.5 or 5.4, and the cutoff is 5.5 to 5.9 at the labs that we commonly use here. This is in percentage. Then you're sitting at the at-risk zone for diabetes. But if you are less than that 5.5, but still having trouble with the insulin, it's important to not only just test the HbA1c, is what I'm trying to say, but we should really be testing the insulin. And even on a fasted state, someone might come in, look perfectly normal, fasting insulin, but when we do that full insulin glucose challenge test, that's where we're actually seeing the insulin resistance present, and all the symptoms start to make more sense. So really important to get that tested: your insulin, your glucose, your HbA1c, then all your testosterone markers, like I was saying, and then also even go a little bit deeper into our cardiovascular system. So checking your cholesterol panel, your liver enzymes, and then even nutritional deficiencies like iron, vitamin B12, vitamin D. These are really important to make sure that we're assessing for those, because I can't tell you the number of times that I have seen vitamin D not tested, and then we test it, it's extremely low. The person starts to take vitamin D and they feel so much better. Energy gets better, mood gets better, sleep gets better, so many things get better. We know there are vitamin D receptors in our reproductive system. which is extremely important to then understand that we need that vitamin D to not only help our immune system, which it has a huge part in play in that area, but also our reproductive system. So if you haven't got your vitamin D checked, please, 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 that should be your number one thing to think of, is getting your vitamin D checked, regardless of where you live in the world. Okay, so oftentimes I've been told this, and actually I had this experience myself where, women are being told, you're not overweight, you don't have any bald spots on your head, you're not hairy, so you definitely don't have PCOS, don't worry. Just keep on trying to lose weight and maybe take the birth control if you really want to regulate your cycles, but it should just level out on its own. And this is so interesting because when we learned about PCOS in school, it was, this textbook case of PCOS is somebody who's overweight, who might be losing a bunch of hair, who has pretty excessive hair growth. Maybe they have cystic acne as well. And as we've learned more about PCOS, what's really interesting is you don't have to be overweight to have PCOS. You can actually be what they call in, our terms, medical terms, is lean PCOS, meaning you're not overweight, but you still have, all the signs and symptoms. You have the high testosterone and, you have issues with blood sugar regulation. And so to somebody who is lean and they actually, because I'm saying lean because actually what we've been told is that in the fat stores, there's actually lots of inflammation, quote unquote. They could be even being called like skinny fat because they're fat store. They still have fat stores, and these stores are actually really sensitive and also not really good in terms of how and where the fat is being stored. A lot of times lean patients will have, this cortisol, or like this little belly, cortisol belly, I call it, or this insulin resistance, little bit belly here, even though they don't have full blown insulin resistance, but they still have family history of diabetes and they have lots of trouble with managing blood sugar. I was like this in the past where I was considered lean PCOS. I had, I was pretty thin, didn't really have any curves or anything like that. And I was told that, when you want to have children, come back and then we'll figure it out then. And that was like a real hard thing to hear because my brain just went into this, oh my gosh, I'm just going to have troubles conceiving. And I couldn't get it out of my brain. And also I did have troubles with weight, even though it wasn't like being overweight. I did struggle with balancing weight throughout the years, especially in my 20s, and now a little bit in my 30s too. And I think that's a direct result of having a child. But even though you're not overweight, you can still have PCOS and you can still have issues with balancing insulin and glucose. And so I just want you to keep that in mind. You don't have to have full-blown insulin resistance and be overweight. PCOS is a spectrum. And I would say that some people sit on the mild form of it, some people sit on the extreme form of it. And it's really just where you are on the spectrum and how many different areas of the body it's being affected by. The reproductive system, the metabolic system, the adrenals, the heart. So there's so many different areas that PCOS can impact. So it's really important to know that it's not just clear cut and that we have to rely on a textbook to really diagnose PCOS. So a little bit about how I was diagnosed with PCOS. This brings me back a long time ago. I think it was now 17 years ago, where I was really struggling with cystic acne. And I was told, it was really bad. I used to wear like MAC, I remember Studio Fix, because I really wanted to just cover everything up. It was horrible. My face was like always inflamed, always red, always these deep cystic acne. And I just thought, hey, I just probably just have really bad skin. And then when I started to get my period, I can't actually remember if my period was regular. I can't remember any of that or what happened there. But I remember getting my period, I think in grade 6. And, I think it was regular. I don't really remember. I remember having pain because I remember actually borrowing my mom's naproxen because I was in a lot of pain. But I do remember that eventually I took the birth control pill because I was using it for my skin, because that's what I was told. I was like, use the birth control, it will help clear your skin up, and it'll make everything better. And it actually made everything extremely worse for me. I know birth control can really help women, but for me, it just did not work. It actually made everything worse. I ended up feeling depressed, and then I went on an antidepressant because of that. And I found that actually after coming off the birth control, my cycles also got really irregular, and I think it was the same time that I was going through second year university. So lots of weird changes were happening, lots of stress, and I felt like this was a huge you know, change in my life. Like, just learning about, oh my gosh, my whole life, I was thinking that I was just, this South Asian woman girl who was just super hairy and had acne. And now I realized why I was, for so many years as a child, and I didn't even know this, but I was like craving sugar all the time. I remember drinking like mango juice from juice boxes, and then drinking it from like the carton because I loved mango juice. And also like just bags of like mini eggs. I remember when I was 16, on my 16th birthday, my friends made me this massive box, and they put like the 16 favorite things that I had, and one of it was literally a bag of sugar because everyone knew that I needed like 3 tablespoons of sugar in my tea, to make sure that that's how I took it. That's exactly just how I took my tea. And so this actually finally made so much sense. I actually found a naturopathic doctor thanks to my mom. She told me, go see a naturopath. I saw one, it's really good. She's going to help guide you on this. I went to see the naturopath. She said, hey, first of all, you have really bad yeast in your gut. And second of all, I think you have PCOS. So let's go get an ultrasound and blood work. And lo and behold, that's when I got diagnosed with PCOS, and everything started to make sense. My cystic acne, my hirsutism. At that point, I was having some hair loss, but not extreme. And now my irregular cycles. And, really changing my diet. And the number one thing I did, obviously, was take out sugar. So if you're really struggling with PCOS, or you think you might have it, or you're not sure, taking out the sugar is the number one thing. I remember drinking juice all the time. And it took me a while to like get the juice out. But what I would do is I would slowly take it out. I'd put like half juice, half water, half juice, half water. Then like, 1/4, a little bit, just a very little amount, and then all water into my cup. And I finally was able to get juice out of my diet. I used to drink Coke and all these pops and Sprite and ginger ale and all of that. And I stopped all of that too. And my sugar cravings came down tremendously. I felt so much better. I had a conversation the other day with a patient of mine, and she was saying that she was having struggle eating breakfast, just getting up and eating, like just not feeling hungry at all. And she's like, we started doing like a protein smoothie. I was like, literally, the only thing you need to do right now is try to get a protein smoothie in the morning. She's like, okay, I'm going to try this. So she comes back and she's like, Samina, I did the protein smoothie. And I was like, what happened? She's like, I finally have so much energy during the day. My cravings have gone down, and I just feel so much better. I'm actually sleeping better too. That is also a direct reflection of a supplement that she's taking. But I really feel like because she's balancing her blood sugar now, and she's not even still that hungry in the morning, she's kind of forcing herself to eat, but her appetite has gone up because she's sleeping better. That she finally has energy and she feels better. And this was a huge part of what I went through too, is just like taking out that sugar and balancing the glucose was a huge step to making my whole body feel better, less anxiety, more energy, better mood. And I can't remember about my sleep. I think I've always slept well. But honestly, little changes like that when it comes to PCOS can make a massive difference in someone's life. And so if you're also struggling out there with, I don't know what I should eat, I have no idea, really just try to add a bunch of protein to your breakfast, at least 20 to 30 grams, and just see what happens. Because even that one change can make a huge difference and set your body up to start the day with balancing blood sugar the way it should. And so yeah, I was diagnosed when I was 19. I really worked on my gut health, cleared the candida out of my gut, started eating more vegetables, also balanced blood sugar by reducing the sugar in my diet, choosing complex carbohydrates instead of just having white bread and things like that. And I'm going to go into a lot more detail in my own personal journey in this podcast and really explain to you also how I ended up going dairy and gluten free. So stay tuned for that. But, what I want to say is sometimes it can feel so overwhelming when you get a diagnosis of PCOS. You have no idea what to eat, how to move your body, how to balance anxiety and depression if you have those. But what I really want you to learn and understand is this is a lifelong syndrome, and really trying to understand about your body every day by what you're putting into it, how you're managing your insulin, how you're managing your stress is just going to get you one step closer to really balancing it all out. It can be overwhelming at first because you think you need to change every single thing. And let me tell you, it actually took me about 5 years to go fully dairy free. And I tell this to my patients all the time because they get so overwhelmed and I'm like, you have to go dairy free. And they think they have to remove it for the rest of their life. And you don't. But just giving you a little bit of perspective that it's okay to make these changes. Things will be okay and you will figure things out. Stay tuned for the next episodes in my podcast. I can't wait to share more. Really excited to be here and just explain a little bit about a woman with PCOS going through this journey, ended up becoming a naturopathic doctor, and now I'm helping women out there with PCOS and literally loving my job, my career, and I'm just so happy that I get to share my own personal experience with all of you out there. So hope you enjoyed this podcast. Please, please, please let me know, send me a message, and I will see you in the next episode. Bye, everyone. Thank you for tuning in to the Natural PCOS podcast. I hope you found today's episode insightful and empowering. Remember, managing PCOS is a journey and you're not alone. For resources, tips, and to connect with our community, visit my website at saminamitha.com. You can also find me on Instagram at dr.saminamitha.nd. If you enjoyed this episode, please subscribe, rate, and leave a review.